Now, our feature presentation.
Hello, everyone. Welcome back to another exciting WMA Club meeting, and welcome to Chapter 4, Quattro, of our Spring Break Workshop Spectacular. Happy Monday to everyone. Today is going to be healthcare planning. Yes, you did not know that healthcare planning actually does fall in line with wealth management. It actually does. So if you guys are ready, I know I'm also ready. Let's get this party started, baby. All right. Let's get this handy dandy slide going up on here. Just gotta make a little adjustment there. Sorry about that. Make sure it's full screen. Does. All righty, here we go. Chapter 4. Let's go. So today we're going to talk about what is healthcare, why is it important, the benefits of healthcare planning. I'm also going to talk about the 3 types of healthcare planning: individual, family, community. We're also talking about the key considerations in healthcare planning, the steps in even applying that. We're also going to talk about successful examples of healthcare planning. We're also going to talk about the challenges of them. And also at the end, we're going to talk about the conclusion of all of what we talked about today. So let's get started. We're first going to talk about what is healthcare planning. Well, healthcare planning refers to the process of developing strategies, policies, and programs to improve the delivery of healthcare services to individuals and communities. Healthcare planning involves identifying healthcare needs, assessing resources, and developing goals and objectives to address those needs. So then I talked about what it is. Why is it even important? And why is it important to wealth management? Well, healthcare planning is important because it helps to ensure that healthcare services are accessible, affordable, and of high quality. Effective healthcare planning enables healthcare providers and policymakers to allocate resources efficiently, prioritize healthcare services, and address the changing healthcare needs of the populations. So let's talk about some of the benefits of healthcare planning. We first have improved access to care. Healthcare planning helps to ensure that healthcare services are accessible to individuals and communities, regardless of their socioeconomic status or geographic location. By identifying healthcare needs and then developing strategies to address them, healthcare planning can improve access to care, particularly for underserved and marginalized populations. Next, we have cost effectiveness. Healthcare planning can help reduce healthcare costs by identifying opportunities to streamline healthcare services and eliminate inefficiencies. By prioritizing preventative care and early intervention, healthcare planning can also reduce the need for expensive medical interventions such as hospitalization and surgery. And finally, better health outcomes. Effective healthcare planning can improve health outcomes by ensuring that healthcare services are evidence-based and targeted to meet the specific needs of populations. Healthcare planning can also promote health education and disease prevention, leading to a healthier population and reducing healthcare costs in the long term. So now we're going to talk about the 3 types of healthcare planning, which is individual, family, and community. In this workshop, I will go over all 3 of these healthcare planning types. Let's start with the individual. See, the one individual right there. Okay. So this type of planning focuses on the healthcare need of an individual patient, hence the name individual, one person. Individual healthcare planning involves in assessing a patient's medical history, current health status, and healthcare needs to develop a personalized care plan. This type of planning involves healthcare providers such as physicians, nurses, and even therapists who work with patients to develop a care plan that meets their individual needs. Then we have family. See, everyone's hands in the circle there, family. Go family. This type of planning involves developing strategies to address the healthcare needs of families, including parents, children, and other relatives. Family healthcare planning may involve identifying risk factors for certain health conditions and developing strategies to address them. This type of planning involves healthcare providers as well as social workers, psychologists, and other professionals who work with families to address their healthcare needs. And then we have the community. See, we got all these people here. They're all one part of a big community. So this type of planning involves developing strategies to address the healthcare needs of entire communities. Community healthcare planning may involve assessing the healthcare needs of a community, developing strategies to improve the access to care, and promoting the health education and disease prevention. This type of planning involves healthcare providers, policymakers, and even community organizations who work together to develop strategies to improve the health of the community. So let me now talk about the role of healthcare providers, policymakers, healthcare organizations in healthcare planning, because they actually do play a crucial part in this. Healthcare providers such as physicians, nurses, and therapists, like I said earlier, play a critical role in individual and family healthcare planning by assessing patients' needs and developing personalized care plans. Policymakers are responsible for developing healthcare policies and programs that address the healthcare needs of populations, while healthcare organizations are responsible for implementing these policies and programs. An effective healthcare plan requires collaboration among healthcare providers, policymakers, and healthcare organizations to ensure that healthcare services are accessible, affordable, and of high quality. By working together, these stakeholders can develop strategies that address the changing healthcare needs of populations and promote better health outcomes. So let's now consider the key parts in healthcare planning if you do consider to start doing healthcare planning. There are several key considerations that need to be taken into account in healthcare planning. These considerations can impact healthcare planning by influencing the type of healthcare services that are needed, the resources required, and or the way the healthcare services are delivered. Some of these key considerations in healthcare planning include demographic changes, emerging health issues, and healthcare policies. These considerations impact healthcare planning by influencing the type of healthcare services that are needed, the resources required, and the way the healthcare services are delivered, like I stated earlier. Healthcare planners need to take into account these considerations when developing healthcare strategies and policies to ensure that the healthcare services are accessible, affordable, and of high quality. By taking into account these considerations, healthcare planners can develop effective healthcare plans that meet the changing healthcare needs of populations. So let's talk about now the steps in healthcare planning, which basically there are 5 of them: assessment, analysis, development of goals and objectives, implementation, and evaluation. Each step in the healthcare planning process is important to ensuring that the healthcare plan is effective. The assessment step provides a foundation for understanding the healthcare needs of the population, while the analysis step helps to identify the root causes of healthcare issues. The development of goals and objectives helps to provide direction for the planning process and to ensure that the strategies developed are aligned with the overall health goals. Implementation is critical in ensuring that the healthcare plan is put into action and that the resources are effectively utilized. Evaluation helps to measure the impact of the healthcare plan and to identify areas where improvements can be made. By following these steps, healthcare planners can develop effective healthcare plans that improve the access to care, promote cost effectiveness, and lead to better health outcomes. So let's give you guys now a couple of examples of successful healthcare plans in today's society. Now, obviously, I think probably when I actually go to the next slide, you're probably going to know one of these because it is known all around the world. But the first one you probably never heard of. So let's talk about the one that everyone does not know about, the Affordable Care Act. The Affordable Care Act, or the ACA, is in the United States and the National Health Service in the United Kingdom, which are 2 successful healthcare planning processes of healthcare planning. The ACA, also known as Obamacare, was signed into law in 2010 with the goal of increasing access to healthcare for millions of Americans who were previously uninsured. The ACA achieved this goal by expanding Medicaid, providing subsidies for private insurance, and implementing new regulations on the insurance companies to improve coverage for pre-existing conditions. The ACA has been credited with reducing the uninsured rate in the United States, particularly among low-income and minority populations. A study published in the Journal of American Medical Association, the JAMA, found that the ACA was associated with a 5.5 percentage point increase in the percentage of adults who have health insurance. So now we talked about the ACA in the America. Let's talk about in the UK, our good friends over in England, the NHS, not National Honor Society. No, the National Health Service, obviously. Don't want to get those confused. So the NHS in the United Kingdom is a publicly funded healthcare system that provides free healthcare to all residents in the United Kingdom. The NHS was established in 1948 and has been successful in improving healthcare outcomes for the population. The NHS has been credited for reducing mortality rates. Man, I am losing my place today. Mortality rates, particularly for cardiovascular disease, and improving access to healthcare services for all residents. A study published in the Blanket found that the NHS was associated with a reduction in age-standardized mortality rates for all causes, with a particularly large reduction in deaths from cardiovascular disease. Both the ACA and the NHS has had a positive impact on healthcare outcomes by improving access to healthcare services and reducing the financial burden of healthcare on individuals. The ACA has been credited with reducing the uninsured rate in the United States, while on the other side of the coin, the NHS has been successful in reducing mortality rates and improving access to healthcare services in the United Kingdom. These initiatives demonstrate the importance of healthcare planning in improving healthcare outcomes for the populations. So let's talk about now the challenges, because yes, in life, there are going to be challenges in doing stuff. Like, for example, taking an exam. As an example, there are challenges in taking an exam. There are. So let's talk about it. So healthcare planning can be challenging due to various factors such as limited resources, competing priorities, and political and social barriers. One of the major challenges to healthcare planning is limited resources. Healthcare systems often have to balance the competing demands for providing high quality care while managing costs. This can be particularly challenging in low-income or developing countries where resources may be limited. One way to address this challenge is by prioritizing interventions that are cost-effective and have the greatest impact on health outcomes. This involves conducting a cost-benefit analysis of different healthcare interventions to determine which ones provide the most value for resources invested. Another challenge is competing priorities. Healthcare planning involves making decisions about which healthcare issues to prioritize. This can be difficult when there are multiple competing healthcare needs, such as infectious disease, chronic disease, and mental health, which has actually been getting a lot of praise in the last couple of years due to COVID. Addressing this challenge involves developing a comprehensive healthcare plan that takes into account all healthcare issues and prioritize interventions based on the needs of the population. Political and social barriers could also be a challenge to healthcare planning. Healthcare is often influenced by political and social factors such as cultural benefits and values, social economic status, and access to healthcare status. Addressing these barriers require collaboration among stakeholders, including policymakers, healthcare providers, and community members, like I stated earlier. This involves engaging in community outreach and education to increase awareness about the importance of healthcare and to address cultural and social barriers to assessing healthcare services. And in summary, addressing these challenges in healthcare planning requires a comprehensive approach that takes into account limited resources, competing priorities, and political social barriers. This involves prioritizing cost-effective interventions, developing a comprehensive healthcare plan, and collaborating with stakeholders to address political and social barriers to healthcare access. By addressing these challenges, healthcare planners can develop effective healthcare plans that improve access to care, promoting cost-effectiveness, and lead to better health outcomes. So, in summary, what did we learn today? So in summary, healthcare planning is a critical process that involves accessing healthcare needs, analyzing data, setting up goals and objectives, implementing interventions, and evaluating outcomes. Healthcare planning is important because it ensures that healthcare systems are responsive to the needs of the population, promote cost effectiveness, and improve access to quality care. The key considerations including demographic changes, emerging health issues, and healthcare policies. These considerations impact healthcare planning by shaping the priorities and goals of the healthcare systems. And some successful healthcare planning initiatives, such as the ACA and the NHS. The challenges basically include limited resources, competitive priorities, and political and social barriers. This can be addressed by prioritizing cost-effective interventions, developing comprehensive healthcare plans, and collaborating with stakeholders to address political and social barriers to healthcare access. And then in conclusion, healthcare planning plays a critical role in improving health outcomes and ensuring access to quality care. By addressing the challenges, considering the key considerations, healthcare planners can develop effective plans that promote cost effectiveness, improve access to care, and lead to better health outcomes. Alrighty, and that is it for chapter number 4. I hope you guys enjoyed this chapter as much as I did. So the next time we're going to see each other again, let me pull up my handy dandy iPad here just to make sure I tell you guys what the right one is. It's going to be, the long-awaited, updated version of Fundamentals of Building and Maintaining a FICO Score. Yes. If anyone was a OG member of the WMA club, you might have remembered we did hold a workshop back in the way back. If you go back in the archives, like 2020, we did hold a workshop on this. And now 3 years later, we're going to be making an update on that. So hopefully I make the OG board proud when I actually remade this. And I did include some of the old ones that they include in there. So, it's kind of the best of both worlds. So with that being said, that is all for me. We will see you all tomorrow, Tuesday, 6 p.m. for chapter number 5. Until next time, this is Jack Mitchell saying so long. Have a great rest of your Monday, and we'll see you all tomorrow. Bye-bye.